All right, awesome. So thank you everyone for joining us tonight for this Research in Action webinar. As a little bit of background, this session tonight is part of a series of Research in Action webinars being hosted by the SisterSong Research Department. Um, the goal here is really to get folks who are doing interesting reproductive justice related research into conversation around research, advocacy, activism, and really start to bridge some of the perceived gaps between all of those spaces. So tonight we are joined by two incredible researchers who are also advocates around endometriosis. As you might have noticed in the title of this webinar tonight, they're both early career, and so we wanted to really have this moment to platform what that can look like, what the beginning of a career that melds together research and advocacy can be. And because it is Endometriosis Awareness Month, it felt like a really good opportunity to specifically highlight these two individuals. So I think we can just start with introductions. That works for the both of you. If you can share your name, your affiliation or affiliations, as I know you both do a lot in all of your roles, and what drew you to this work, and also give the audience just a little more information about the specific work it is that you do. And I can just, I'm looking at Izzy right now, so if I can pick on you first.
Yeah, of course. Hi, everyone. I am so thrilled to be here and so thankful to Noelle for inviting me to be here. My name is Izzy. I am a second year MPH candidate at Columbia University, so I will have my Master of Public Health in 2 months. I'm very excited about it. And then I also work as the Community Health Program Coordinator for the Endometriosis Foundation of America. I do that part-time now, and then we'll continue on in the role once I graduate. I also have various other affiliations. I do some research at the University of Pittsburgh, doing arts-based mental health and also some menstruation work, and various other roles within Columbia as well. I got into endometriosis research and really my entire public health trajectory because my life sort of stopped in the middle of undergrad after actually my very first semester because of my own experiences with endometriosis. So I went from studying chemical engineering to totally changing my entire path and moving toward public health because I saw how much it changed my life and decided that earlier education and awareness could have had a completely life-changing impact on me. And so since then, I have moved on toward research, education, and advocacy. So my research in endometriosis specifically has been a little bit less than in some other topics. I do a lot more with menstrual health, menstrual practices. I have done a little bit of clinical research in endometriosis, some work that isn't published yet, but looking at pelvic floor physical therapy, as well as a bit with endometriomas. I also, within the Endometriosis Foundation, I work on our community programming. So I help run a program that involves us going into middle schools and high schools and teaching students about endometriosis. We're a nonprofit organization. Everything is completely free of charge. We also develop and distribute materials to schools and community events. So I have things for teachers, nurses, coaches. We also do a lot of like working with patients. So we had our patient day and medical conference a little over a week ago. We did a Friday, Saturday, Sunday, full days working with physicians and patients. And then I also just spent last week in Washington, D.C., doing some more legislative advocacy. And so we work at all sorts of different levels, and I'm just really excited to be here to talk about all this work and how it intersects with reproductive justice.
Hi everyone, my name is Malavika. I'm really excited to be here and thanks so much for having me. I am a first year medical student at Sidney Kimmel Medical College at Jefferson, which is in Philly. I also went to college pretty locally at Swarthmore. Um, I don't know, there's a lot of really interesting things that I've been getting involved in this field since I began college. So my freshman year of college was when I got started with women's health research. And since then, actually, one of my first roles was as Noel's research assistant. And it taught me so much. And that was my first foray into menstrual health research. There was a lot that I learned on that path, and especially attending conferences like the Society for Menstrual Cycle Research, so SMCR. That was what led me to endometriosis research for the first time. I think as a medical anthropology major and someone who has kind of learned to have a more systems level perspective on like understanding health issues, um, I've been drawn to topics within healthcare that feel like they affect the most vulnerable populations. And when I heard about endometriosis and learned about the diagnostic delays that it entails, and the amount of medical trauma and gaslighting that's so prevalent in the community, that was what drove me to focus on this topic for my thesis research at Swarthmore. Some of the other things I'm working on right now, I also study substance use during pregnancy, along with the University of Pittsburgh and Duke. I'm also birth and postpartum doula, which was something that I got trained for the first time in college. And also organizing doula trainings was a big part of some of my reproductive health work in college as well. And currently in med school, I also volunteer for a shelter that's for women and children who are unhoused. Um, there are a lot of reproductive and sexual health needs that we address in the clinic, looking at things like health insurance, different supplies like toiletries, clothes, all of that, talking to them about sexual health, smoking cessation. So I've kind of tried to expose myself to this field in many different ways, especially because I know that once I complete my medical training and get into the clinical field, I may lose some of that breadth in what I'm doing. But I also want to call out that my biggest inspiration in even having these interests in the first place was my family. Something that I learned a lot through personal experiences before I ever got interested in public health or medical anthropology was just about care and community. And like a lot of the things that we think of as so important, like support systems, it's very much not equal for everyone. A lot of people give a lot more care than they receive in return. And something that I saw as a pattern in that was that a lot of women in my life give more care than they receive. So that has been a mission for me since I got started with this, that I want women to be able to have stronger support systems. And that's what continues to guide me.
Awesome. Thank you both for those introductions. I realized I didn't introduce myself to the audience. So, super quickly, my name is Dr. Noelle Elizabeth Spencer. I am the research manager at SisterSong. And if anyone on this call doesn't know what SisterSong is, we are a reproductive justice organization based in Atlanta, Georgia. If you want more information about SisterSong, we can put the website in the chat. We would love to have anybody interested, give us a follow on social media and look at the website and get involved. We are all about reproductive justice, which again is the human right to have a child, not have a child, parent the children that you may choose to have in safe and sustainable communities, and the right to bodily autonomy. So if you're interested, please do follow us for more. Okay, with that shameless plug, I'm going to go into the rest of our questions. It is an orientation thing too for our audience. We are planning to go until about 7:30. We might finish up a little bit earlier, but that's kind of our hard out is 7:30, and there will be plenty of time for questions too of the panelists. So please feel free to put those into the Q&A box, and we will grab them from there, or either Q&A or in the chat. I'm not sure if you can see a Q&A, so I think it might be chat. Oh no, there it is. Okay, yes, in the Q&A box. Cool. All right, so thank you both for sharing all of the many incredible things that you do. Um, I would love it though if you could share a bit more about your work specifically related to endometriosis, and it's all of any of your work, any of your research, and the intersections between them. Is it easier if I pick who goes first? Well, we can switch it up. We can do Malavika first.
Yeah, for sure. So a lot of my endometriosis work has been related to my undergraduate thesis, which I completed at Swarthmore. Um, I was I did a special major in medical anthropology, as I mentioned, that was housed in the sociology anthropology department. And we had a lot of freedom to like kind of explore different topics within the health sciences, but like take a more social perspective on it. I like I mentioned, I think I mentioned my inspiration, so I won't get into that too much. But the topic of my research was looking at patient-physician relationships, and the ways in which they communicate and navigate conflict. This was really interesting to me because a lot of the literature that I was exposed to was related to conflicts between patients and physicians, especially from like a angle of how patients are being dismissed by their physicians and not able to find care. They keep going to person after person. They're still not able to um, get like an accurate diagnosis or accurate treatment. So I was like, what is actually the interpersonal element of that in these interactions when people are talking with each other? What's actually happening? And for the people that are able to find some sort of solidarity or camaraderie with their clinician, how is that working out? And like, how can that help model positive encounters between patients and physicians for the future? Um, so I completed interviews with both people who have endometriosis and clinicians who treat the illness. And I did it virtually, so I was able to talk to people across the country, which was really cool. And I also, especially wanting to have a more ethnographic approach, did some field work at a Mid-Atlantic academic medical center, which was really awesome because it's a perspective that I really couldn't have gotten through interviews because I essentially was like shadowing physicians from morning till evening every single day for about a month. Um, and like a lot of this exposed me to like break room conversations and like just being one-on-one with doctors where they might be like a little bit more personal and talk about their family, their feelings, their true reflections on what it's like to do this work. Um, and so I completed my thesis in the spring of 2025. And so that is like in the Swarthmore repository for like theses. But I've been trying to get the information out more widely, the findings that I got from that. There were really some key themes that I focused on in my findings. The first one was thinking about how people are taken to be credible or not credible simply based on their identities. And this had a lot to do with like um, gender, education, things, strategies like doing online research, trying to dress differently to look older or more mature. Um, and then there were a bunch of other things as well. I think one of the main things was looking at how a lot of systemic issues within gynecology itself. So this is not just interpersonal, but just the way that gynecology is structured with insurance reimbursement, funding for research, OR time, physician shortages, how all of those things kind of contribute to physician burnout and make it harder for physicians to actually put their time into caring for their patients. So the doctor themselves may want to do a better job and understand their patient, but there are so many systemic level issues that they're kind of forced to spend 10 minutes with each patient. And the patient's impression is, this doctor doesn't care about me. They don't think that I'm sick. So just trying to understand how misogyny is affecting the medical system and how that is translating to these issues in the relationships. But that's pretty much what the research was about.
Thank you, Malavika. What about you, Izzy?
Yeah, Malvika, I love your thesis work. It was so cool hearing all about it as you were working on it as well. So my work is a lot more research-informed practice as opposed to doing the research itself as often. As I was saying earlier, I started off doing a little bit of clinical research, and then I ended up getting my undergrad degree in gender, sexuality, and women's studies. And as part of my capstone, I wrote a paper about power dynamics, which very similar to Malvika's work, the provider-patient dynamics and how patients take back some of the power when they are in the physician's office. And a big part of that was also looking at the myths surrounding endometriosis. So, for example, physicians will often share with someone who has endo that if they become pregnant, their symptoms will go away. But recent research, and actually a lot of this is in a book that was recently published, shows that a lot of these myths are at their core based in eugenics from around the 20s. Looking at that and understanding that was very foundational for the work I've done since. Moving forward, after I graduated, I worked with the Endometriosis Foundation with helping revamp their educational curriculum. So I took their e-course and translated it into a Kahoot, something that is a bit more engaging for the students. They have this really wonderful animated video that we have. It takes you through the experiences of a high schooler named Maya as she grows up and her experiences with endo. And I always really loved that. And we have a few other videos, but are now actively working on creating new, more engaging things. We, let's see, what else has there been? So our patient day and our medical conference happened more recently. And this is really a space for that dialogue between physicians and patients. So we really value those interactions, and a lot of that involves bringing the current research that's happening and making it accessible for patients because people with endo often find if they go to a general physician that they know more about the condition than the physician who's in the room. And so part of what we try to do is give tools for self-advocacy and also to help both the patients at our conferences and also through our educational program allow people to understand you can always get a second opinion and some tools for self-advocacy, but then also understanding that sometimes you sadly won't be listened to or believed or understood no matter what the situation is. And while we are trying so hard to make that better, giving tools for coping with that and knowing what your next steps can be. Another thing that I'm currently working on is my thesis. So I am doing an evaluation of our educational program, which involves analyzing the data from surveys that our students complete. There's qualitative and quantitative components. I'm focusing primarily on the qualitative, so talking about what they think should be improved. And then I'm also interviewing our volunteer educators who actually go into the schools to provide these lessons. And I am compiling a bunch of findings from that I will then propose to the foundation as we make our next iteration of our program, using that in combination with a focus group that we recently did at our patient day, asking all of the patients what they liked about our videos, what they didn't like, and what suggestions that they had. So, really foundational to this work is listening to, believing, and trying to understand the experiences of endo patients, oftentimes by using research methods, but then going directly to the practice piece.
Amazing. Thank you both for sharing more about what you do, on in terms of the research you're conducting, how you are implementing that research, what dissemination has looked like. It's really fascinating to hear about all of the different ways that this work can be looked at, engaged with. I am curious because you both did talk about some of the kind of larger, either historical and or systemic issues that are surrounding experiences of endometriosis. So I am curious, um, thinking about that, how would you say that RJ, reproductive justice, for anyone in the room, not using acronyms, my apologies, is centered in the work that you do? And how does it show up in your work?
Yeah, I figure Malvika and I can
Yeah.
alternate going first. So in my work specifically, I try to think of the whole picture and the systemic level of everything that we look at as much as humanly possible, which I have definitely learned over time that it's trickier in practice than it has been in the classroom, but we are certainly doing our best. So one example would be how with my capstone in undergrad, learning about the history of a lot of these myths that we see come up. Then moving on to sharing that with our patient day and with people when we're discussing, because I find that there is a validation in that. And so understanding how systemic and historical a lot of these challenges people are facing has been, I've been told it's been healing for the people who have been in attendance. We also like to bring in um, all of the different disparities around endometriosis care whenever we can. So, one of the things that I quote the most often is that it takes on average 7 to 10 years to be diagnosed with endometriosis, but for women of color, it's 14 years. And so that is something that we try to keep in mind and understanding that everyone has horrible experiences with this disease and also understanding how it impacts different people different ways. And so when we are thinking about creating educational materials, thinking about how to do this in a way that we have something that can be broadly applicable to as many people as possible while still being individual to as many experiences as possible, which is something that we're actively workshopping because in my interviews with educators, we have heard from some people that they loved our program and from some people that they wish they saw more acknowledgement of these inequities in our program. And so I think one of the biggest ways that we think about it is making sure to go to the people who are going to be receiving this lesson. So we talk to high schoolers and then our educators and understanding what might be missing. Another piece that we've been talking about more lately is that fertility aspect and how it relates. And so, not to continue going back to the historical piece, but when we talked about how a lot of this is based in eugenics, it's because there was a physician who said that pregnancy could stop endometriosis from worsening or could improve the symptoms. And a physician said, then went and told wealthy white women that they were the only ones that could have the disease. And that people who were not wealthy, and especially women of color, they said that they are not able to have it and should not get pregnant. Um, and that is one of the most jarring things that I learned, and something that we try to bring up in a sensitive way, but make sure that there is education around that. And we don't just bring this up with patients, though, because the physicians are the ones in the room. And so another piece would be initiating dialogue with physicians as much as possible and making sure that they aren't perpetuating these things, especially because oftentimes physicians might learn in medical school, especially if it's been a while, that a hysterectomy could cure endometriosis, which we know isn't true and we know happen disproportionately. And so just, I think that was a lot of different pieces, but taking it back to RJ and Endo, trying to make sure that we don't forget that there are these connections because there's so many, and it can be overwhelming to try to remember them all and take them into account. But keeping in mind, always going back to the community that you're working for and asking if you're doing a good enough job and accepting that the answer might sometimes be no and trying to learn from that.
Yeah, I love that answer, Izzy. And like from where you started off thinking about the whole picture, I feel like I've also tried to take a similar approach. And something that I also learned a lot in college was just questioning the system and the status quo. I think there's a lot of like, especially in the medical field, and now being in med school, I see it more like in my peers and even my mentors here, but it's very easy to accept the system as it is because it feels so set in stone. And succeeding such a long history of being the way that it is, that it feels like, oh, because it's been there for a long time, it must be right because that's the way that it's been done. Um, so the way that I try to center reproductive justice in my work is try to actually just highlight the justice part of it and understand that the way that things are and the inequities that are produced as a result of that don't have to be like that. And that there could be changes in the system that are causing it that could produce different results. And like it feels very simple to say it, but the thing is, there's so many issues that once you start like getting in there, it feels like an endless list of things. Um, just like for example, when you're talking about misogyny in medicine, it's like that's not like a oh, and guys, let's just not be misogynistic anymore sort of issue. There's a lot of even like I would say something that I've been reading about lately is even just the way that OB-GYN is one thing, OB and GYN. And that actually was reflected in a lot of interviews I was doing because participants that I was talking to who have endometriosis were saying that their physicians, a lot of them were generalists, so they both deliver babies and take care of the obstetrics part. They also do the gynecology, which includes like taking care of endometriosis. So they were saying like it looks like they're just like babies and like stickers and pictures of babies all over my doctor's clinic. And like I don't think they care about anything other than me except for my ability to like be fertile and produce children. Um, One of the participants was even saying like other than talking to me about how endometriosis affects my fertility, it seems like none of the other quality of life aspects actually matter, like the chronic pain. Um, so just thinking about that, like separating OB and GYN is a conversation that's happening right now, but doing so would be such a huge change. But I'm trying to go into the space in my research, having like a mindset of there are a lot of different things going on here. There's no one issue that exists by itself that I need to address through my work. And just being willing to see all the issues and not get overwhelmed by them and be willing to talk about all of them, especially in the presence of people who are willing to do that work with me and possibly even have the power to like make the changes in that space. Um, I think that's been the most impactful for me so far, in trying to connect reproductive justice to this research.
Amazing. Thank you both so much for taking a deeper dive into the connection of reproductive justice to the work and the research that you're doing. Um, I am curious. I know you've both mentioned it a bit about, especially with the research that you do being pretty community-based participatory research focused, being pretty qualitative, of engaging with community in those ways. And Izzy, you've talked about the patient days and things like that. But I'm curious if you could share a little more about how you continue to engage with community in the work that you do, and also how community has influenced your journey as an early career researcher. And oh, sorry, before you, sorry, I just want to say, because I'm seeing something come through the chat. If you are putting questions, please do remember to put them in the Q&A part. And then in the chat, there's a little drop down that can change the just host and panelists to everyone if you do want to chat to everyone, just to let folks know. Okay, thank you. Take it away.
I would say one thing that's connected my work to community is actually just having a lot of conversations with people. I mean, I naturally am kind of drawn to topics that are talked about a bit less or considered more sensitive. But I kind of found it interesting that after I started doing this work and started talking about it just for like, oh, I'm doing this over the summer, people would disclose their personal experiences of endometriosis to me when I never knew that that was something that they were experiencing or struggling with. So there were a lot of things that people personally talked to me about with like, oh, this is also something that I've gone through. You should look into that. And kind of like nudges in different directions in my research that have been really helpful. And then I'll also say my work in the shelter that I've been at for the past few months has been really interesting as well. It's, I would say, less like specifically pointed towards endometriosis and more just towards reproductive health and reproductive justice. But thinking about things like access and like conversations about education, contraception, all of that. I feel like a lot of us who are in academia, like at least in like some aspect or the other, are like kind of sheltered in our daily lives and what we see. There's a lot of like, oh, you read things on the internet on like PubMed or something or a journal, or you talk to other researchers, or you go to a conference and you see a poster about something. But being in a real space where people are struggling with their reproductive health, um, and need access to things like abortions or prenatal care or postpartum care, and seeing how scarce it is and um, how hard it is to connect people to things and how many like hoops there are to jump through with like insurance and costs and all of that. I feel like that has been the most eye-opening thing is like doing this work. I think even like in my medical practice, there's a lot of like I think in med school, one good thing that I've been exposed to is like Jefferson has a thing called Health Sciences Systems, where we have lectures specifically on how like public health affects medical practice. And there's a lot of talk around things like insurance claims getting denied, for example, or like things that just don't work out with the system that are out of your control. Like, for example, being a pulmonologist and there's just a lot of pollution in a particular city, like there's only so much that you can do to prevent your patients from getting exposure to all the pollutants. Um, but I guess like understanding that that uncertainty will be there, but there are still things that I can do. I don't know. I feel like act the biggest thing for me relating to like community is just understanding how much of it is outside that bubble of like just the manuscripts and the posters and the conferences and all of that. Seeing how messy the real life actually is and like what it's like to actually help someone who's in a distressful situation like that. And understanding how hard it can be, but the fact that there is community out there that is focused on public health and doing this work. So it's a bit of a weird and not straightforward answer, but I feel like so far that has been my experience.
Awesome. Yeah, and just jumping in. So thinking about my experiences, I've been thinking a lot lately about how we define community. I had a professor push back once recently when we were talking about community during a discussion and who we're really talking about. And so I just want to name that like with endometriosis, you have the community of people who have endo, but then within those there are other communities of people with different experiences, whether it could be due to race, gender, where you're living, lots of different ways of defining the community, but then also providers or friends, family, different relationships. There's so many different ways to think about this community. In my work, we think of teachers and like school nurses as well as part of the endo community, whether or not they consider themselves as such. And so I think part of what we do is taking into account every person who might be involved and the different ways in which they might be involved. Um, I get a lot of messages coming through, just like through the forms in our website, from people talking about a loved one who has endo and asking what they can do. There's one I've been thinking about a lot recently where a man messaged that his friend's daughter has endo and how he's seen the horrible toll it's taken and how he wants to know if there's a way that he could get involved in the way that he could help. And it's really just been a powerful example of how much people want to get involved and see this as part of their community. But then going a little further, so I consider myself in part of this community in so many ways, a big piece of which is that I have endo myself. And so when we are doing this patient day or we have our different events, when I work with our volunteers, it is a really empowering experience for myself, just being surrounded by all of these people who care about something so passionately in the same way that I do. And while many didn't make it their goal in their career, they still take the time to come out and meet people with these similar experiences. And I never want to take that for granted. There are also another huge part of it is that I don't just create the lessons, I go out and I teach them. So I am regularly going into schools and teaching the lesson that I helped create, and we're always making changes, but then also teaching at, for example, I'll be speaking soon for I think it's New Jersey nurses dinner event that they have every year and speaking about endometriosis there. I didn't personally do this, but we recently had a presentation for all school nurses in New York State. And so we are really trying to branch out and go a little bit as far as we can. We are a tiny little team, but I really value that. And then, in addition to professional, just in my own life, my own community, I joke that, which it's not even a joke, it's true, that whenever I meet a new group of people, I can't go without diagnosing at least one person with endo, diagnosing. Bringing up, you might want to talk to your doctor about endo every single time. And the amount of people that have come back to me and said, "Oh my goodness, I saw my doctor. They think I have it too." It's really powerful. And so, even just being someone who knows about this and talking about it makes you part of that community, and it is just so powerful. And it's hard to overstate how vital it is, this knowledge piece is, because it's how someone can get care. And that we know that so many people aren't believed. It's 75% of people with endo are misdiagnosed at least once. And of those, just under 50% are told that all of their symptoms are due to a mental health condition, which oftentimes there are mental health difficulties that come along with it, but that's not why you're having pain and heavy bleeding. And so, by being knowledgeable about this and being able to support each other and understanding the large diversity of experiences and really being in touch with your community and understanding how you sit in it and how you can support others, it's just been really, really vital for me and healing for me. And I've heard similar things from others who I work with. Long-winded answer.
Not at all. Well, we asked, so I love to hear both your responses. I did hear a lot of kind of points of synergy across both, about the power of talking about some topics that are sometimes seen as maybe uncomfortable for some folks, maybe taboo, depending on where folks are sitting. As someone who works in menstrual health and in family planning, reproductive justice, definitely feel that and align with that. And also, that's part of the reason that we're doing these types of conversations, right? To make sure that information isn't behind paywalls. It's not seen as just something that lives in the ivory tower, like what you were saying, Malvika, about, sometimes these issues get kind of trapped behind this idea of it's just an academic question when really it's people's lives, and it's a combination of those things. Even going back to what you were saying, Izzy, about who is community, like what is meant by that. I wrestle with that a lot too. What do we mean? What do some folks mean when they say it versus others? And what it means to be in and for community at the same time. So I thought that was really interesting. It came up with both of you. Um, yeah, I would love to know a little more. And you've both talked about this a bit, so we can definitely skip this question if you feel that there's nothing else you want to add, but did want to still offer the opportunity. If there's anything else you wanted to share about how your work bridges research and practice.
Yeah, I can just add one more component. We are always getting questions from patients or just people reaching out. And so I am always deep in the weeds of research, and I am very thankful that I've had the training to be able to understand a lot of it. And every time I look at it, I am realizing more and more how inaccessible it often is, like we've been talking about a lot. And so a big part of my role really is taking that research and thinking about how can we make this publicly accessible. So like for example, I train all of our educators. So I'm actually tomorrow night doing one of our trainings. And a big piece of what we talk about is, okay, here are the findings, here's the research, but then here is how you talk about it with adolescents in a way that they can understand it and in a way that isn't scary. And so in public health, we always talk about making your language accessible and the reading level that you want to deliver your messaging in. So that way it is easy to understand. And that applies very, very much with this. One last piece of this that I don't think I've touched on yet is the legislative part of it. So I was very thankful to have the opportunity to be in DC, and I did a little bit of lobbying, I think. I don't know, but going to door to door to representative offices and actually taking some of those numbers that I feel like I can just rattle off all the time at this point and actually sharing these things has been so important, and understanding the wide breadth of research that is out there. So thinking about who am I talking to and what do they care about? So is this someone who will care about the fertility piece or the equity piece or the cost piece or the insurance piece? And I can care about all of it, but knowing how to find that research and who to talk to about what has been a really good learning experience for me and a really interesting way of taking that research into what I do on a daily basis. But I think I covered pretty much all the other ways.
I'd say, oh, Noelle, were you gonna say something?
No, I was going to invite you in, so go for it.
Okay, perfect. I think like when I was thinking about this question, it's kind of interesting because I feel like my life and my education is almost like the embodiment of the gap between research and practice because I'm talking about patient-physician relationships and I'm trying to like I'm working to become a physician. And so it's a really interesting space where I mean one obvious part of this is that I hope I can embody the kinds of positive values that I discuss in my papers, thinking about what are the things that make patients feel validated, what are the things that foster trust between people with endo and their clinicians, things like that. There's also a certain amount of like just talking about it with my classmates and like not even endometriosis by itself, but just the concept of advocating for your patient, or understanding what kind of background they're coming from and not doing things like you for example using terminology like non-compliant, or like judging patients for like different struggles that they go through, even things like substance use disorders. We actually just like my clinic, my shelter just had a talk on substance use disorders, and a lot of that discussed like language, and the ways that it can be so impactful when you say things like addict versus someone within a substance use disorder. Um, but there are a lot of things like that I find have been really interesting, and like just trying to imagine how all of these classmates that I have right now are going to be doctors one day who have their own patients, and how just being a med student and just like helping like have this attitude right now and this perspective that I mean like we really are the sum of the people that we're surrounded by. And so I hope that I'm at least contributing a little bit into like influencing the people around me who, if they're not already sharing the same beliefs, kind of having that sort of mindset towards the people that they're going to see in their clinical practice. And then in like a more like professional note, I'm also trying to uh, disseminate my findings in like less of an academic way and trying to get it out more into practice through things like op-eds and things. That's like currently my next step. I have been working on a couple of papers, but I'm starting to write an op-ed with a physician who I felt had a lot in common with me in terms of her perspective around like systems levels issues in gynecology around endometriosis care. So I'm really hoping that some of these things that I put out are going to be in the hands of policymakers and like people who can do something other than the people who have endo and like are treating it, which it's still important, but also there's only so much that those two groups can control anyways. But just trying to diversify the ways in which I'm talking about it so that a variety of people can be exposed.
Yeah, and if I can just echo one piece that you shared, Malvika, because I think we're saying, I love how similar our answers have been. And I just also want to echo the stigmatized language thing because we see that so often and in so many contexts. And endo is really no different. Like you can, sadly, a lot of patients can look at their chart and see some of that similar language or opioid seeking behaviors, things like that show up in charts. Um, and so I just appreciate you bringing that up. That's a very important piece of it.
Yeah, absolutely. Absolutely. The language piece, the policy piece, the really making sure what you were saying, Malavika, too, that the information is getting out to a variety of different folks who can create change in different ways. So exciting to see the work that you're both doing and to see how it does start to impact all of those different groups. Because you are both early career, I am curious to know a little more about your journey and specifically about how mentorship has impacted your journey.
Yeah, I feel like I'm in good company talking about this question because Noelle has been one of my most significant mentors in this space. So and you're laughing, but it's a true statement. I I've definitely really been influenced by people who have been in this field longer than me, who have kind of shown me the ropes. And I feel like Noelle in particular taught me a lot about community-based participatory methods. And I remember like always asking her about these definitions. Before I understood what it was at college, I was like, "What is an ethnography?" And she like had to give me this entire like explanation. And I was like, "What's the difference between what we're doing right now with the interviews and ethnography?" It's kind of funny because that's like the direction that my thesis took. And like looking back, there were so many conversations that we had with each other that informed the perspective and directions that I've taken in my work. Um, and I feel like definitely a lot of things that I mean, I guess I can only speak for myself, but I feel like as an early career researcher, a lot of what I'm doing is really, really shaped by my mentors because like basically starting out with no knowledge or information about this when I'm like in like a freshman in college. Because in high school, a lot of my work was about like mental health, and like it was like more quantitative research, and it really had I mean, I guess there was some overlap, but not that much with like public health, endometriosis, all of those kinds of topics. So when I started working with Noelle, and I also had another PI, Vivian, who did research around intimate partner violence. Those two were the ones who kind of brought me most into the space of thinking about social determinants of women's health. And then I would say in the sociology and anthropology department at Swarthmore, a couple of my professors, Professor Shitsi and Professor Ganam, were the professors who taught me the most within the space of medical anthropology. And that really shaped my perspective around questioning the systems as I was talking about before. I think earlier I very much was like growing up in the Bay Area, very sheltered perspective on life. But I learned a lot about how differently people are treated in the healthcare system, and how even some of the things that we take as like completely for granted, like for example, when someone wears a white coat or has a stethoscope, we just assume that they have medical expertise, and like things like that, that like you just kind of associate with a clinician or with the medical system or whatever. It's actually like these are just social norms that we get used to because we do it again and again, right? And we see other people partake in them. And like when you break it down into things like that, then it makes you think like, why even are we doing that thing? Why are we thinking of it like this? Why are we calling it that? And it kind of like shattered my worldview a little bit, which is weird right before starting med school to like shatter your worldview about the medical system. But it's definitely a good thing now that I'm here, that I'm applying that because everyone's voices that like the mentors that have taught me, like Noelle and Vivian, also Dr. Chang, who connected me to them, who works at the University of Pittsburgh, my professors at Swarthmore. I feel like those voices have really, really stayed in my head. And honestly, now that I'm here and I'm just learning about like enzymes and like biochemistry and like physiology, like all those things that like I have to study to be a doctor, but also like don't really fill my soul to the same way. It like is so much more important to me now looking back. I'm so grateful that I had that mentorship before, and that I still have those people in my life that I can turn to when I have questions about these things. But I think those voices hopefully will always be there for me and guide my work.
Yeah, like Malavika, I've been so lucky to be surrounded by so many amazing mentors. I'll try to keep this from sounding like an Oscar speech, but so many people have been so amazing throughout this whole process. When when I first became sick, I ended up transferring to the University of Pittsburgh, and I knew I was really interested in endometriosis. And I reached out to a physician there who allowed me to do some research with her and shadow her as a physician. And it was really, really wonderful getting to see her work and what it actually looks like to do these surgeries and to be speaking with physicians. And funnily enough, as much as I love that, it's how I realized I wanted to sort of move away from the clinical piece and do the public health piece. And so that's when I found Dr. Sarah Bauman, who has been a huge mentor for me for years. I think we're on fourth or fifth year of having worked with her, and she does a lot of work around menstruation. And that's where I found qualitative research. And it was with her that I learned how much I love hearing about individuals' experiences and how I find the numbers important, but I find the why to be really central and what I personally really love and where I find my skills lie. And I am very thankful to her mentorship and all of her guidance with that. I still work with her. We just had a paper published today, which I'm very excited about. But she also introduced me to arts-based methods and human-centered design, which I now use. We actually used some arts-based methods and human-centered design during our patient day and medical conference last week. And so the fact that I can just learn all of these amazing skills and was just able to reach out to someone and say, "Hi, your work is amazing. Can I learn more?" I'm very grateful to her for letting me do that. And I've just had so many amazing professors along the way as well. When I decided not to pursue the medical direction, I also switched from biology to gender, sexuality, and women's studies, and I did most of that major in a year, which ended up being a lot. But it also meant that I met so many amazing professors who were able to challenge me in how I think about endometriosis and just my worldview as a whole. I expanded beyond endometriosis and menstruation, even though that's really my passion, and learned more about some of those other topics. And then after coming to Columbia, adding in another perspective and really um, CBPR, so community-based participatory research, and some of the actual methodology in building interventions and doing evaluations. And I am so thankful to all of them as well for the fact that I have had so many professors that are always happy for me to email them and say, "Hi, can we chat about this thing that you mentioned? I think it's really cool." And the, I think one thing I have realized is that academics and all of these incredible people that I admire so much always felt so scary until I reached out and I told them how much I loved their work. And they were always so thrilled to chat. And I am so grateful for that. And then now coming to EndoFound, in addition to all of these academic mentors I have long had, I also have professional mentors. So, my direct supervisor, Carolyn, I just reached out to her on LinkedIn and I said, "I'm obsessed with your work. Can I work with you?" And I got lucky and she said yes. And it totally changed my whole trajectory. And now I've been working more closely with the rest of that team. And I had the ability to go to DC and learn about lobbying when it's something I knew nothing about. And so just mentorship has been so foundational to everything that I've done because the amount of times that I've been allowed to just say, "Hey, this is cool. Can we talk about it?" Or "Can I help in some way?" And I have been welcomed with open arms. It has just been really astounding to me. And I have learned so much more than I thought I would ever have the chance to. And so, very thankful to have learned from such a wide variety of professionals who have taught me so much about this whole field.
Amazing. Well, thank you both for sharing about how mentorship has impacted you. Thank you, Malavika, for your kind words. That was very sweet. That was very funny. And congratulations, Izzy, on your paper that came out today. That's huge. Please do, if you have a link for folks, feel free to drop that in the chat so that folks can access it. Speaking about disseminating things far and wide. So exciting. And I love this question too, because mentorship has really played a huge role and continues to play a huge role in my life as well. So, I think it's an important thing to think about, yes, for early career, but throughout one's career. But it's definitely, like both of you said, very impactful at the beginning stages too, even if beginning stages is a career pivot later in life. At any point that changes are being made, it's helpful to have folks in your corner. Awesome. So I'd love to hear from both of you what you would say is the impact of your work. Again, expansive about what work is, whether that's your research work, your advocacy work, the combination between them, something else is on advancing reproductive justice as a movement. Like how is your work moving that forward?
Yeah, I love that. And I need to think on this one because there's always just so many thoughts and so many ways as we've talked about. Um, I, so there are just so many levels of work that always need to be done in reproductive justice, in endometriosis, and there's so many different ways to do it. And I think we all need to help push the needle a little bit in every way that we can. And so, in my little corner, how we're doing it is largely that education, awareness, and activism piece of it. So, in mine specifically, calling out the disparities that we see in endo care in many, many different ways. Like we can't talk about endo without talking about the racism that is inherent in every single system. And we can't pretend that that's not there. And if it's not intentionally put in every single conversation, then we're failing simply. And we also know that because of that delay to diagnosis, there are a lot of misconceptions that we try to point out in that there is incorrect research, past research saying that white women are the most likely group to have endo. But we know that that's not true. They're just the most likely to be diagnosed. And so there's a lot of issues in the numbers that we quote. And so one little way that we consider reproductive justice, or I guess this is more equity as a whole, but thinking about the language that we use and looking into the data that we're going to quote, because I'm in a privileged position where I'm in this organization that has this voice and that we're able to share information, and what we share is treated as fact. And we need to really take that seriously and be intentional about what we put forward and making sure that everything is accurate. And so I make sure to challenge a lot of those statistics because oftentimes one paper is citing another, which is citing another, and the research itself was done 50 years ago when we didn't have the same technology that we do now. And so I we really like to point that out, both externally and also our internal conversations as a team and thinking about our own team culture and what our priorities are. Um, some of the other pieces, definitely the advocacy, and I think I've talked a lot about the educational piece. Making sure that everyone feels represented and trying to close those gaps in who is diagnosed, who's aware, who reaches out to their physician. And I think one of the biggest ways is by emphasizing that trust yourself. We believe you. We understand that you are having these horrible symptoms and you might not always believed, and that is horrible, and you deserve to be believed. And giving some of those strategies for here's how you can find a doctor that might be more likely to help. And so we provide more of those like broader strategies to help individuals, which will hopefully close some of those gaps. Um, I might have more to say, but I will pass it off to Malvika for now.
Yeah, I'll say there are a few different things on my mind. I think one thing that comes first is I would love for more people to see the findings from my research and be able to benefit from that. And I think one thing with my work is it it is inherently like a very personal topic. It's about relationships. So it's not about anything where you have to really like reach to make it work, where it's like, oh, it's about this, and then like maybe it means this, and that's how I can apply it to my life. But it very much is like, oh, when clinicians say this to patients, they feel like this. And then patients and clinicians fight about this. But one way that they can repair those conflicts is through this, or like this is what people have talked about have worked for them. So they're very real, like anecdotes and quotes by the people in the study that are so rich and illustrative that I think will be very straightforward for people to be able to read and better understand the perspectives of the other group, and kind of have a little bit less like I feel like a lot of existing literature. I mean, it is amazing the way it is, but there's also a little bit of framing like it's patients versus clinicians. So it's very hard to like read that and learn from it other than, oh, I if I'm a clinician, like I shouldn't be a jerk and like dismiss my patient or something like that. But there's very little on like kind of working together on like being mutually respectful and validating each other. Because as weird as it sounds, like there are also certain insecurities and fears that clinicians are facing in their practice, especially with female clinicians who are treating endometriosis. They themselves are comparing themselves to their male colleagues and saying like, oh, I am putting my foot down about like this diagnosis or this treatment because nobody takes me seriously like they take my male colleagues seriously. And so it's like it's not coming from a place of wanting to dismiss their patient. Sometimes, it's not always, but sometimes it's just coming from a place of insecurity. And that's also coming from a place of like bigger social and cultural conversations about gender and legitimacy and credibility and all of that. Um, so I'm hoping that that's one of the effects that I can make with the work. I think another one is just being trying to become a model on how clinicians can also be patient advocates. Being early career, I don't think anyone is looking to me as a model right now. So this is something that I am more looking to as a goal that I want to cultivate and foster within myself as I'm going through my medical training. And like I already talked about the components of like just being in community with my peers and just letting us influence each other. But even looking at the future, it is one of my goals to work in academic medicine. So I really would love to continue doing research and also get involved with teaching and mentorship myself as I learn more. So something that I would want to do is kind of pass on the kinds of lessons that I've learned through my mentors to the students and trainees who may become my mentees. And the nice thing about medicine is there's like such a hierarchy to it that like once I'm a resident, there will be med students under me. And then if I'm a fellow, then there'll be residents under me. And so like there will always be people that you will be able to look up to and mentor and like vice versa. So I'm really excited for those opportunities to get to talk to people about just especially the kinds of things that Izzy was talking about with patients being able to be heard and like believe them for what they're saying. Because especially with endometriosis not having reliable diagnostic tools or like interventions, our most powerful tool is listening to the people themselves that have the illness. And if you were to deny their testimony in the first place, it's like, what are you even gonna go off of at that point? So just also like making it like highlighting the fact that there are different forms of knowledge. It's not just medical knowledge that matters. It's also the learned knowledge that we have from like our lived experiences. And this is something that I want to keep like advocating for even as a clinician, that my what I learn in med school is not more important than what other people know about their own bodies. It they are like equivalent in some levels, and in other levels that knowledge that the people have about their own bodies is more important than the medical knowledge that I'm going to gain. So trying to practice with that kind of mindset and help share that with others, I think is a priority for me.
Amazing. Well, thank you both for engaging with, and you're getting some love in the chat. Engaging with that question of, how your work is impacting the future. And I do also want to assure you, not in a scary way, but in an important way that, just because your early career doesn't mean that folks aren't already looking up to you both, which is such a fascinating thing. I just think, especially when you hit like mid early career and it's like, oh, I thought I was still at the beginning, but no, and that happens fast, friends. So rest assured that people are already looking at what you both are doing, especially given the breadth and depth of what you do, for inspiration for the future already, which is an exciting and important thing. I do have one final question, then we'll open it up for Q&A. And that is just a quick question, small question, about what are your hopes for the future of this work? I know, tiny question.
I think my answer is kind of like a mumbo jumbo of everything that we've talked about, which is very nice. I think part of this is definitely policy for me in a way that I didn't foresee when I started my research. I always was curious about like other people's policy efforts, but I didn't really know that I myself would want to step into that space. But something that came up a lot in my work was stuff about insurance reimbursement. And it really comes down to how women's healthcare is being valued. and it is not being valued. Even within OB/GYN, the reason that I had brought it up as like OB and GYN before was I was really surprised to find that within that field, actually obstetrics and procedures related to pregnancies are reimbursed far better and higher than gynecologic procedures. And so this came up in my research in terms of the literature that I was reading with like theoretical things, like for example, from Emily Martin, but also from my participants, that it's a sense of like women's lives and health, it's not important unless we're bearing kids. So that's something that's very disappointing to me. And I think if we were to be able to uh, put more resources and efforts into gynecology, that could make a really big difference on women's quality of life. Because if you think about it, like even if you plan to become pregnant or you have been pregnant in the past, what percentage of your life does does that actually take up? Most of our lives, we are just as we are. We are not like I don't know, like either pregnant or breastfeeding or something like that. I think for the majority of people with uteruses. So to be able to say that someone does not matter unless they're pregnant, I mean that's completely unfair and doesn't make sense. So there are a lot of efforts being done in that space where clinicians are trying to change the RVU, like relative value units that each procedure is worth. And so this would change physician compensation, but this would also change like different things, like for example, how many patients a physician would have to see per day, or like it would even attract a different number of med students to then pursue OB/GYN as a specialty. All of these things are interconnected. And honestly, if physicians are compensated higher, that does influence things like physician burnout, and they could also see less patients per day and then spend more time with them and then build better relationships with them. So I like first I thought, okay, reimbursement is boring, like this has nothing to do with my research, but so many of my participants were bringing up in the interviews that I was like, I can't not look at this. So I would love to be able to kind of join those efforts and help like adjust like the valuation of those procedures and however that I can be helpful, basically. Keep doing the kind of research that I'm doing. I'm still really invested in this topic of patient-clinician relationships, and I want to keep going with that. There were a lot of fruitful findings from my study, but there are definitely still gaps. Um, and yeah, like I mentioned, I just want to keep maintaining these values in my own career as a medical trainee and a future physician. And hopefully that will all round out and make me someone that hopefully I can be proud of someday in the future.
You're going to do such amazing things, Malvika. I'm excited to follow everything that you do. And I'm going to echo a lot of what you said. There's so many levels, and so I'm just going to daydream for a minute. I would love for excision surgery, which is the best treatment we have at the moment, to be fully covered by insurance. Right now, people are getting insufficient or the incorrect treatment because of cost, and we know that's true about so many different things. And endo is the same, but there's nothing else really as good. Um, Also, endo isn't recognized as a disability formally, and so you aren't able to receive disability benefits if you're unable to work because of endo. I really want to see that one change. That really impacts a lot of people. Um, some more awareness, a disease that 1 in 10 people are diagnosed, but 18% research is now showing are impacted, of people assigned female at birth. The fact that so many learn about the disease the day that they're diagnosed and how jarring and terrifying that is just absolutely ridiculous. You're coping with your symptoms, you're coping with the fertility aspect, which is so hard if you're especially young. Um, and it's also can be validating, but still so scary. And so people need to be aware of it younger so they can be diagnosed younger and get treatment younger. Also, we don't have any non-invasive definitive diagnostic methods, which there are so many really cool things in the work that I'm really excited about. There are papers in the works and some recently published that are awesome, and hopefully we'll have something soon. But right now, the only way you can know for sure if someone has endo is through surgery. And that's not acceptable, just simply not acceptable. Right now, you can get a presumptive diagnosis based on your symptoms, or in 25% of cases, something like an endometrioma, which is basically when endometriosis is in the ovary and forms a cyst. That can be seen on an ultrasound or MRI. Sometimes deep infiltrating endometriosis can be as well, but that really requires someone with a lot of skill being able to read the MRI or ultrasound, and we need a better way of diagnosing people. The lesions are so microscopic, and the amount and size of lesions don't necessarily correlate with the amount of symptoms someone experiences. It more depends on the location of the lesions it's looking like, but we don't even entirely know that. Um, so yes, better diagnostic methods and then treatment. Birth control is not a forever treatment, and surgery doesn't always work for everyone. It's not a permanent fix for everyone. It also, endo has so many comorbidities, so many other conditions that can come along with it. Central sensitization is something that I've been thinking about a lot lately, which is when, if your body is in pain for a long time, it starts to recognize everything everywhere as pain. So if you have pelvic pain for an amount of time, then your body is just so used to being in pain that it thinks all of you should be in pain all the time. And we see that more and more often, that even if you have the treatment, because it's been so long, you're still in pain, even if the pain generator is gone. And so we really need that early awareness, diagnosis, and treatment. And we need better diagnosis and treatment in order to address all of these things. And I would just love to be in a world where everyone who says my period is painful, or just everyone as a whole, can be screened for it and treated if they have it before we ever get to the point of these symptoms being debilitating. That would be the big dream. We'll see. I know Malavika and I are both doing our parts to get us as close as we can.
Absolutely. Thank you for contributing that big dream to the space. And like you said, you are both well on your way. And I am truly so in awe of the work that you are both doing to, move the needle, more than just move the needle, but really create real impact so early on in your careers, and that you're following your passions to make sure that folks have the access and the education and ideally policy change that they need to be able to have full realized lives that are ideally pain-free. And I absolutely join you in that big dream. I do want to first direct you to the chat. You have a lot of accolades in there. I also just want to open it up now to questions from our attendees. I do see one has come out so far. So this is an open invite to anyone who is an attendee. Please feel free to put questions in the Q&A. We would love to hear from you. And as I believe Nia put in as well, just so you know, there will be a follow-up email going out that will include some information from both Izzy and Malavika about some of the work that they've talked about tonight, different links that you can follow, as well as the information about SisterSong. So please be on the lookout for that. Also, this webinar is being recorded and it will be on the SisterSong YouTube, hopefully next week. So absolutely something you can watch back or share with folks who are curious. For this first question, I will read it to you both. So it says, I've read so many blogs, articles, and studies about endo. Oftentimes, I don't know what is accurate and what applies to me. How do I verify what I come across online or even from doctors? I've also seen a lot of doctors too. It's exhausting. Absolutely. Thank you for sharing, Christy. So wondering if either of you have thoughts on this.
Yeah, I can jump in. I get questions like this a lot in my work, and I have so many thoughts, and I wish I had a easy, quick solution for this. Um, Sadly, there isn't one. There is so much misinformation out there, and I do want to emphasize that if you come across misinformation, it often is not done maliciously. It's because they have heard misinformation, and accurate research is so inaccessible. So just that caveat. I would start by looking at, where did it come from? Is this a reputable resource that I'm looking at? Are they citing their sources? So is this someone naming a fact that you can't find anywhere else? And if you can find it somewhere else, where are you finding it? So are they linking back to an article where you can see the same statistic is quoted there? Or when you trace through it, do you not see this anywhere else? I would also be wary about things like blogs or on social media. Um, there they are places where I don't want to say echo chamber because that has such a negative connotation. And really, these are just places for people who are trying to get help. But if misinformation is put in those spaces, they easily spread and can be amplified in these spaces as well. And so I would start with finding some reputable resources and learning as much as you can. I'll, of course, point you toward our website because that's all information that I'm familiar with and know about. Um, but I think just checking, was this peer reviewed? Um, is this information somewhere that you can find it to prove that it's not someone's opinion? And when it comes to physicians, that is really tricky. So thinking about, is this person an expert in this topic? So there is no such thing as an endometriosis specialist or an endometriosis expert, quote unquote. It's not an official certification. It's not anything officially recognized in the medical system. But what is are minimally invasive gynecologic surgeons, which is also called MIGs. And these are physicians who are a lot more likely to be accurately trained about endometriosis. So that is often where we tend to direct people toward. Also, if you can find them speaking and how they talk about endo, that can be very helpful. But also with physicians, if your gut is telling you something's off, I always will encourage people to get a second opinion and to always have a second person there with you at appointments to take notes and help verify things as needed.
Thank you, Izzy. And just letting folks know again, the link to the website that Izzy was talking about with resources will be in that email. So please keep an eye out for that. Um, awesome. Anything you wanted to add, Malvika, before we go to the next question?
No, I love Izzy's answer. I also have come across a lot of online forums like when I was working on on my project on Facebook and on Instagram, but it really is like a mixed group. And like I was thinking of a group, but I think it's best for me not to like recommend anyone's source because I also like am not someone who has personally taken advice on there and I can't personally attest to the credibility of any of the sources, but I think the way through which we can self-assess the reputability, I think what Izzy said is pretty good.
Absolutely. Thank you, Malvika. Thank you, Christy, for that question. It is hard to find good information out there, but absolutely there are ways to do it. And thankfully, once you find those trusted sources, that tends to open doors. And thank you, Izzy, for giving some really practical advice for how to do that. So next we have a question from Trinity that says, where does funding for endo treatment research typically come from? I don't actually know this, so I'm curious if either of you do.
I am not completely confident either. I know that there's a lot of like applying for grants from various sources. Some of it is like I think institutional based on like various hospitals or research centers that are affiliated with those hospitals. Some of it is like grants through the NIH or like other larger sources like that. But I think with the current like administration, um, the the funding, like the federal funding for such research is has been minimized by a lot. So I think in the present landscape, I don't think I have like a very specific answer, but that is what I know so far.
Yeah, it's definitely tricky, and a lot of funding has been taken away recently. Um, so there you have your two big categories. You have the funding that goes directly toward endo research, and then you have the funding that is tangentially toward endo research, but is directly towards something else. So, for example, there is some research coming out of the NIH about, or that is happening about inflammatory chronic illnesses and diseases. And endo is a piece of that. And so a lot of what you see with endo is it being nested in with other conditions or components of it being looked at, or endo research that has broader applicability. But there is, of course, NIH funding is always going to be a bigger one. Endo found we don't provide big funding or anything like that, but we do smaller seed grants for researchers to use to hopefully get bigger grants down the line. And then some others also will provide smaller funding, but I think a lot of it is federal and institutional. But sadly, I think it's something like there is $1 of funding for every person with endo in the US. Like it's a very, very small number. Um, it's something like a sixth of the amount for male pattern baldness. Don't quote me on that number. I'm trying to remember the specific one, but yeah, not a lot.
Well, thank you so much for sharing, both of you. Yeah, it is always interesting how siloed research funding is because, I do a lot of kind of tangential research to endo, but since I don't do specific endo research, it the funders all have their priorities, which is absolutely fair. But it is an interesting landscape to be trying to get funding for anything related to people's bodies who have uteruses at this current time. But thank you for that question, Trinity. It is the question I think all of us will continue to ask is where are we finding this funding? Um, awesome. Okay, well, I'm going to double check the chat. I don't see any other questions coming through. Is this kind of last call as we wrap up if you have burning questions for our panelists? I will also just say again, thank you everyone for coming. I will note in the chat, Nia has been putting a couple links in there. One is to an evaluation form for SisterSong. So please take a moment to evaluate this session. Let us know how we did, what you liked, what you learned, how we can improve. We will share this with the panelists and with the rest of our team. We really want to know how we can make these webinars useful to our broader community. I'll also note that this has become a bit of an endometriosis awareness week for us at SisterSong and the research team. So we have our second panel of the week on Thursday coming up, a collaboration with Endo Black. And that panel is looking at patient perspectives on health disparities in endometriosis care. So please come back around for that one. It is same time, 6 p.m. Eastern on Thursday, and the link to register is in the chat. And any final words for our audience, Izzy and Malavika, before we wrap up?
Hmm. I think just thank you all for being here and being part of this conversation. And I, if anyone has additional questions or wants to chat about any of this stuff, or if I mentioned something and you want to know where I got that information from, please email me. I don't know if my email is going out in the email blast tomorrow, but I'll make sure that I'll check to make sure that it is. But yeah, please be in touch and thank you all just so much for being here. I love talking about this stuff and would be thrilled if anyone wants to discuss any of it further.
Yeah, same as Izzy. I'm really happy to see the turnout and to see how many people, since it was advertised as early career research, I was thinking to myself, I'm like, there are probably much more like the people who are more advanced in this space or who understand this better, who maybe would be more attracted to like a panel with very, very I don't know, people who are much further along in their research careers. But I think it's just the fact that we all share this interest and passion for endometriosis care, I think is very heartwarming. And like I'm also really just happy to have a colleague in Izzy and like to talk about this together because it's amazing to see the work that other people are doing. And like I think we have taken such different routes of going about it, but ultimately we have such similar values and reasons for doing this work. So I'm really grateful for that and for the existence of this panel for giving us a platform to talk about this. And I also have shared a booklet that I made about my thesis with Nia, who is I think, going to be doing the email after this panel. And the booklet has some of the main findings from my thesis without people having to read the whole entire thing, which is very long. And it also does have my email at the end. So anyone who has any questions about my work or who wants to talk about anything in general, I'm always willing to talk about it.
Amazing. Well, thank you both so much for saying yes, for spending your evenings with us, for, really educating us about what it is that you do, what you're passionate about. That is such an incredible gift, and just all of the gratitude to you both for sharing this time, and all the gratitude to the attendees for coming out, for staying with us for almost an hour and a half on your Tuesday evening. It's been a pleasure to get to meet all of you virtually. And, please keep in touch. And as, Izzy and Malavika said, please keep in touch with them. If you'd like to follow along with their already illustrious careers, please do so. Um, and we hope to see you at the next webinar. And again, this will be on YouTube, so please feel free to watch it back, share it with your friends, so we can get more people talking about endometriosis, because it's incredibly important and we need to break the stigma around talking about it. So with that, we will say good night. Izzy, there was one question in the Q&A for you. Okay, awesome. But just wanted to flag that. Thank you, everyone. Have a wonderful evening, and we will see you soon.